Right, good afternoon. Yes, as Gideon said, I'm Alistair Bradley. I'm the leader of Chorley Borough Council up in Lancashire, a politician amongst health experts and feeling like a fish out of water perhaps here this afternoon, but hopefully I'll explain why I'm here. Just to give you a bit of an introduction, we're here to discuss some of the work that we're trying to do with the Health Science Network in the last year or so to bring to Chorley an innovative and digital health village for our area and for the wider Lancashire area. This is part of us, if you like, having an input into the health sector, but perhaps more importantly, the health sector having an input into our economy, because we need to build closer links between residents, the training and educational institutions in our area, and also the fact that public health increasingly is becoming an area that local government is getting involved in. The difference that we've got perhaps is we are a lower tier authority. So in metropolitan areas like Liverpool and Manchester, you've got single tier metropolitan unitary authorities. In Lancashire we have a different setup where we have a county council with a load of district councils and unitary authorities beneath those who operate on two levels, a wider strategic level and a more focused local level. But a bit like the health sector, local government is being increasingly pushed to work closer together. At a time when budgets are being cut, we are all having to work together to achieve the same aims and objectives. If I just set the scene in Chorley then at the moment about what we're trying to do. We are in an ambitious borough, an ambitious place, and we're looking for new and radical ways to work with partners of all kinds. We started this, as Gideon referred to, with Public Sector Reform Board, which is an attempt to work closely with partners across the public sector, health, police, all kinds of people, to deliver our services jointly. The more we can do of that obviously has mutual benefits. As part of that, we've recently been given a £1.23 million funding from DCLG, which was awarded to Lancashire County Council, Chorley Borough and also Rossendale to pilot some work in our areas around the wellbeing area of work and about coordinating support to residents and early intervention, and that work will be commencing shortly. We also are trying to look at investment opportunities in our area. I think we have accepted that whatever party of political persuasion is in government, the amount of money that's going to be given in grant, etc., to local government will reduce, and therefore local government has to try and fund itself and also fund the services it wants to see delivered within its areas to its residents. As part of that, we're looking at investment. One of those investments, for example, was last year when we invested £20-odd million in buying Market Walk Shopping Centre, which was an interesting change for a local council at these times to be investing that kind of money. And perhaps what I want to do is set a bit of the context about what we're trying to do to improve our local economy. We're investing in trying to create jobs, bringing local private sector investment, but also local public sector investment into our area so that we can build on the work that private sector organisations are doing, but also retain that public sector work in our area. As a result of that, we've created over 1,000 jobs in the last year within our area. There's been £2 million of investment, which has levered in far more private sector investment. And what we're finding is that we're getting a higher level, perhaps, of GVA or value added for each job that we're providing than perhaps other areas are doing. And what that's then asking us is can we do more than what we're already doing to develop our economy? And what we're particularly interested in is working with the health sector to do that. This brings us on to the land at Exton Lane, which is opposite, for those of you who know it, the existing Chorley Hospital site that we are looking to develop as a digital health village. And I'll come on to that now in a bit more detail. Just to give you a bit more background on Lancashire as a whole, the independent report commissioned in November 2014, quite recently, did explain that digital health is a key growth point in the economy, and therefore we want to look at trial facilities with on-site healthcare provision based on the links with the existing hospital adjacent to the site. We also want to look at the potential for exploiting Chorley's connectivity to the rest of the northwest and to the rest of Lancashire. We have 3 motorways that run through our borough. We have the M6, M61 and M65 motorways, and therefore what we're trying to do is add to the existing offer that may be in place by linking that to all new businesses that may look to locate in that area and add to that existing market. So the proposal in detail, and I want to just discuss this about how we're going to look to bring this digital health village forward, is, as you can see from the slide here, approximately 745 jobs, which is obviously a big addition to any area's local economy. Large areas, as you can see there, of digital health offices, data centre provision, light industrial, healthcare provision, leisure and retail, and also new homes. And what we're hoping is that those homes can be connected in some way to that health provision, again, to extenuate the links between the sites. We're trying to form a partnership here. We can't do all this on our own. We can't do this through private companies just coming in and doing this. It needs to be a partnership. And we're looking to partner with the developer and landowner on the site. We're looking to partner with the county council, and we've bid for growth bid funding recently to develop this site out. Obviously with the Health Science Network as well, and also with the Lancashire Teaching Hospitals Trust, who are right opposite the site across the road. And also what we're looking to do is build the links with the local higher education and further education institutions, which are generally of an excellent level, turning out large numbers of highly trained, highly skilled employees of the future. And we need to find these people jobs. Just to give you a bit of an idea of the sort of master planning of the site, done a lot of presenting on this recently to various people, but the idea of the site is it's developed out. It's very hard to see on this slide at this scale, but to build in all the different options on the site, which is the health, the housing, the health sector industry, the retail options and the leisure options that can also be built into the site. Overall, as a site, it will work in phases. There's a phased option by putting the distributor road in, but what we're looking to do is bring the whole site forward as soon as possible. So in conclusion, what we're looking for is we want a collaborative approach to this scheme. It can only work on a collaborative basis. What we can't do, like I said before, is do this all on our own. I don't believe any partner can do it all on their own. It needs to be a partnership which will be mutually beneficial to all parties. I think we've heard this morning from various speakers who said about placing people, if you like, at the heart of things rather than patients. This is something that we see as a benefit because we see this as delivering for all of us. It delivers for us as a local council, it creates jobs, it creates investment and economic activity. It delivers for the health economy and for hopefully the suppliers within that. It also delivers for businesses and the SMEs because they get a toehold into a scheme that will hopefully give them a long-term place to grow and to develop as a company. But ultimately, it's got to come down to the people who will be patients, but are also people who probably reside in our area and reside in the wider local area. We are aware there's another scheme in the north of Lancashire which has already got funding with Lancaster University, which is tending to concentrate, I think we heard this morning about that, on ageing population, the digital health of ageing populations. We see an opportunity to work on different sectors of the population. Our demographics are slightly different than the Lancaster area and the North Lancashire area. We're closer to some of the larger cities to the south of the area, and therefore what we are really looking for is partners and people to work with collaboratively on these kind of projects. I think if anybody in the room is interested in discussing this site further with us, myself and Sarah James, who's with me today, are very keen to speak to people because we need to develop this as a partnership, and what we need to see is, I believe, more of this kind of work in the future where local government, the health sector and national government work more closer together to bring and deliver for people as well as just delivering for patients. Thank you very much. If any questions, I'm quite happy to take any questions. Thank you.